House Republicans are set to push for a vote as soon as Friday on approving a measure to give President Obama fast-track authority to negotiate the Trans-Pacific Partnership deal. The secretive TPP deal involves 12 countries and nearly 40% of the global economy. On Wednesday, WikiLeaks released a leaked draft of another chapter of the secret negotiating text, this time the TPP's so-called healthcare annex. Newly revealed details of the draft show the TPP would give major pharmaceutical companies more power over public access to medicine and weaken public health care programs. The leaked draft also suggests the TPP would prevent Congress from passing reforms to lower drug costs. One of the practices that would be allowed is known as evergreening. It lets drug companies extend the life of a patent by slightly modifying their product and then getting a new patent. This is a video explaining the practice produced by Doctors Without Borders.
Evergreening. Sounds nice, doesn't it? But evergreening is what drug companies do when they want to increase their profits. And it leaves people in developing countries without the medicines they need. Here's how. A drug company develops a new drug and is rewarded with a patent. The patent stops other producers making the medicine for 20 years. So the drug company can charge very high prices without anyone else undercutting them. For 20 years. When the patent ends, other producers can come in and compete with each other. And bingo! The prices come tumbling down. So the medicines become affordable for everyone. But the drug companies want more profits. So they make a tiny little change to their drugs and ask for another 20-year patent.
Well, for more, we're joined by two guests in Washington, D.C. Peter Maybarduke is Director of Public Citizens Global Access to Medicines Program, and John Sifton is Advocacy Director with Human Rights Watch. Today he's hosting a briefing at the National Press Club on human rights and humanitarian concerns about the Trans-Pacific Partnership, along with Oxfam America and the Council on Global Equality. We welcome you both to Democracy Now! Peter, let's begin with you on this issue of drugs. Talk about the TPP, and for those who have never heard of it, explain its significance, and particularly as it relates to global access to drugs.
Sure, it's great to be with you. The Trans-Pacific Partnership is an ongoing trade negotiation, been going for about 5 years now, among 12 countries, including developing countries like Vietnam, Peru, Malaysia, as well as the United States. And in this agreement, the U.S. Trade Representative and the Obama administration put forward a number of proposals that have nothing to do with trade. There are about 30 chapters. Only a few have leaked. The rest is negotiated in secret. And among the many harmful proposals that have been made by big business are demands to transform other countries' rules with regard to medical patents and many rules affecting people's access to affordable medicines. We're very concerned that the TPP would lead to preventable suffering and death in these countries where people rely on access to generics. There are many provisions in the TPP that would expand the pharmaceutical industry's monopoly power. We're also concerned about rules in this latest leak that potentially have implications for Medicare and for U.S. programming, and most particularly constraining our ability to make some of the health care reforms that the Obama administration has pledged to reduce health care costs for Americans.
And you're just learning this now because WikiLeaks has released the chapter on these issues?
Well, this annex, which is ironically an annex to a chapter called Transparency, is the latest in a series of leaks that have been published that give us more particular idea of exactly what rules are being negotiated. The details matter. You can't get into the negotiations. We do our best to follow by talking to contacts that we know, but due to the secrecy, it's really only through leaks that we're able to evaluate the particular proposals and assess their impact. These are all rules that would otherwise be debated in our Congresses and parliaments out in the open, rules that include many gifts to big business. And so it's very concerning that we have to rely on someone taking the tremendous risk of leaking a document in order to have a real public debate about the issues.
What is the possible justification for not revealing what is in the TPP? President Obama repeatedly says, trust me. He says, you know, Elizabeth Warren, Bernie Sanders, they're getting it wrong. But we are not able to see. The senators can't even see unless they go into a room. What is in this deal?
Yeah, well, the U.S. Trade Representative has come out and as much as said that we can't tell you what's in the agreement because it would create political complications for the negotiation, which is effectively the same thing as saying if people saw what's in it, they wouldn't like it, and we wouldn't be able to pass the deal.
Well, Peter, I want to ask you about what you mentioned earlier about the possible impact of the TPP deal from what has been revealed on Medicare here in the U.S. The New York Times yesterday, Wednesday, cited officials at the U.S. Trade Representative's office saying rules in the TPP would have no impact on the U.S. because Medicare and Medicaid are already adhere to them. Could you comment on that? Of course, they didn't officially comment on the leaked draft, but these were comments that they disclosed to the New York Times.
Well, the administration makes that assertion, but as I say, the details matter. And if you read the leaked text and compare it to Medicare regulations, we're quite concerned that it gives pharmaceutical companies opportunities to say, well, we have broader rights under the TPP than we have under Medicare regulations. We want to be listed in the formularies if we show any therapeutic value. We want to have opportunities to comment at all meaningful points according to our own definitions. And we're concerned that that could mean potentially that pharmaceutical companies might even be able to bolster a claim in these secret investor state tribunals that are much more friendly to investor rules in order to make their arguments about interpretation of the particular term. So we're concerned that there are potential consequences for Medicare A and B today if pharmaceutical company lawyers and lobbyists exploit what they might now see as their rights if this agreement is signed. But we're also concerned about what happens to Medicare Part D in the future. The president's budget includes a proposal to allow Medicare to negotiate for lower prescription drug costs, something that 75 or 80% of Americans support broadly across party lines, could save a tremendous amount of money if it's implemented with a national formulary. And implementing a national formulary under these rules that have just leaked yesterday would be difficult, would be expensive, subject to a great deal of challenge. We know this in part specifically because the Veterans Administration, for example, which is considered a model for procurement practices, has been specifically excluded from the annex, we think, because it's known that these rules would make it difficult for the VA to operate. Similarly, would make it difficult for us to negotiate drug prices the way we need to.